Okay, so good morning everybody. Good morning and welcome back to my channel. So today I would like to talk about some basics in nursing pharmacology. Let me put it that way. Or should I say pharmacology for nursing students? What are the basics? What are the foundational things that they need to know? So okay, let's assume you are new to pharmacology, or should I say, okay, you have not done anything related to drugs before, and then you are in school, and what are the things I need to know? How how will I answer pharmacology questions, things like that. So that's what I'll be talking about shortly today. Okay, of course, we know pharmacology in layman definition, study of drugs, all about drugs, everything you need to know about drugs, the reactions, the indications, the contraindications, everything that you need to know. So as a nursing student, you ought to know that okay, there is a pattern I need to follow. There is a pattern, or should I say, a scheme. Yes, a scheme that I need to know if I want to answer a question in pharmacology or anything related to drug. There is a pattern. So that's what we'll be talking about shortly today. So, um, of course, in nursing we have the medical surgical part. That's where we talk about the disease itself and how we tend to manage them. And of course, we know that in management we have different types. We have the conservative type whereby you just manage conservatively. We have the surgical management, we have the pharmacological management, we have the nutritional management, etc. So majorly our focus as a nursing student will be the pharmacological treatment. Okay, if I'm to give drugs to this patient, or if doctor were to prescribe a drug to this patient, okay, what are my responsibilities? What are the things that I need to know about this drug? Sometimes there may be error, or should I say some malpractice and negligence, and for us to be able to clarify that, and for us to be able to avert that negligence which might come from the person who prescribe the drugs, is my responsibility or your responsibility as a nurse to be able to know the drug. It's only what you know that you'll be able to clarify. Are you getting it? So that's one of the bases why we nursing students study pharmacology, so that to be able to know more about the drugs, I'll be able to help avert so many. So let me just bring down the pattern. So we start from the drug. Let's assume this is a particular drug. You need to be able to know the class, or should I say the group, or should I say the family that particular drugs belongs to. So let's take for example now a drug paracetamol, very common drug. Of course, you should know that okay, this paracetamol belongs to a family or a group called analgesics. So first of all, you need to be able to know the family, you need to be able to know the group or the class where that drug belongs to. Not that they give you paracetamol, you're thinking, oh, this one is to cure hypertension. No, it's an analgesics that is used to cure pain, painkillers. Are you getting it now? So after knowing that particular group, then be able to now know, okay, what's the indication? Indication is more or less like, okay, what's the use? What's the use of that drug? What's the drug used for? What's the indication? And then you start talking about, okay, indication of paracetamol to relieve pain, to relieve fever, things like that. So thereafter, when you talk about the indication, there are so many indications. That's one of our major responsibilities as a nurse. We need to be able to know what that particular drug is used for, so that when someone prescribe a drug to you now, and you know, okay, this is what I know this drug is used for, so you'll be able to know, okay, this is going in line with the disease, this is going in line with the management. Are you getting it now? So let's take for example now, somebody prescribe lisinopril. The first you'll be able to know, okay, so you'll be able to know, okay, this particular drug is to treat hypertension. Are you getting it now? So that's what indication is all about. And then we talk about indication, we now talk about the mechanism of actions. We talk about group, like family, what class does this drug belong to. Then after we'll talk about the indication, okay, what's the usefulness of this drug. Then after we'll now talk about the mechanism of action. Mechanism of action is now showing the pattern, the should I say the pathways at which this drug actually worked in the body system. Okay, take for paracetamol example, they will tell you that okay, paracetamol will go to the pain receptors in the brain and then inhibits the receptors there. So it stops all those pain, like it works with the pain receptor, and then instead of you having pain, because paracetamol now helps to be able to block all those things. So it blocks the receptor so you don't feel pain again. So that's like the mechanism of action. Okay, this is what this drug will do in the body system. This is the pathway at which it's going to go. So that's the mechanism of action. You need to know, okay, how this drug, let me put it in pidgin, how the drug they work for the person body. So that's the mechanism of action. If it were to be fever, how did this drug, me swallowing it, how did it come about that immediately after I swallowed this drug, I know they get fever again? So there is a particular function, there is a particular action that took place in the body system where the signals that were affected, the receptors that were affected. As a student, as a nursing student, you need to be able to know this particular action. After mechanism of action, we'll now talk about the dosage. The dosage. So what is the adult dosage? What is the dose that you need to give to an adult? What is the dose that you need to give to a child? That's like pediatric dosage. What's the dose you need to give to an elderly person? Of course, there will be a variety. You cannot give the same drug you give to an adult to an elderly person. No, you can't give the same drug you give to an elderly person to a child. So you need to be able to know, okay, this is a pediatric dose. This is, just for example now, this is paracetamol. Adults now take 1 gram TDS like 3 times daily. Adults take that 1 gram, but you can't give 1 gram to a baby. Are you getting that point now? So you have to give a lower amount to a baby. So that's about that for the dosage. You need to be able to know their dosage. Then after talking about their dosage, we now talk about the side effects. The side effects. What are the side effects of this drug? Because for every cause there is an effect. It's a cause and effect relationship. So as we have positive effects, we also have negative effects. So as we have a positive effect, it says that when I take this drug, I know the fee pay again. There will still be some little adverse effects, little side effects that you have in your body. The most common type where everybody knows is nausea and vomiting. Everywhere, nausea and vomiting. But there are still some. Like if you give an antihypertensive drug to a patient now, the people will come down, but adversely it can cause hypotension. Are you getting that? So in as much as you are trying to cure the people to come down, if it's not well maintained, the people will crash, which now lead to hypotension. So you need to be very careful to be able to know their side effects. Like if you give somebody pentazocine now, be sure that after giving the person pentazocine, the side effect of pentazocine is to cause dizziness. So as a nurse, I am responsible to know, okay, this is the effect of pentazocine. So immediately you give that patient, you are not going to tell the patient, okay, now you can start going on. No, you are going to tell the patient, okay, you are going to feel dizzy. So can you calm down a little bit, like stay back for like 5-10 minutes and just rest a little, because if you drive or you go home, you feel dizzy and you feel fall, that kind of thing. So that's our responsibility as a nurse. You need to be able to know the side effects so that you'll be able to work on it and able to protect your patient. And after talking about side effects, we now talk about the contraindications. In as much as we know that, okay, this drug can be used for this drug can be, there are still some people that can't take that drug. There are still some people that can't use that drug. That's what they call contraindication. Okay, this drug is contraindicated in this particular set of people. This particular set of people cannot take this drug. Let's take for example diclofenac now. Diclofenac is an NSAID, that's a non-steroidal anti-inflammatory agent. But an ulcer patient can't take that drug. It's contraindicated in an ulcer patient. So you need to be able to know, okay, this particular drug is contraindicated. If you don't know as a nurse and you go and give diclofenac to an ulcer patient, then be ready to be able to trigger that ulcer pain. I don't know if you're getting it. So you need to know, okay, this drug, there are some that most contraindications are very particular to a pregnant woman, especially in their first trimester. because they know that they may be teratogenic to the baby utero, so they don't give some drugs to pregnant women when they are still in their early pregnancy. So you need to be able to know that as a nurse. Then after you've talked about the contraindications, you now talk about your nursing responsibility. So what's your nursing responsibility as a nurse? Of course, I have listed so many things. Your nursing responsibility, first of all, general one is to ensure that you give the right drug to the right patient at the right time in the right place. That's the right truth. So that's one of the major responsibility, to make sure that you chart and document every drug that is given, to make sure that you monitor your patient after giving the drugs. So many responsibility to make sure that I don't give this drug to a patient if contraindicated. So many responsibility. So that's more like the major thing you need to know as a pharmacological student, or as a nursing student doing pharmacology. So I'll just give a recap again, talking about the pattern you need to follow as a what as a nursing student that is preparing probably for a pharmacology exam, and not even for a pharmacology exam alone. You need to know pharmacology as a nursing, you need to know drugs. So I said it that first of all, you need to know the group that this drug belong. And after all, I said you need to know the indication of the drug, that's GI. You need to know the mechanism of action, N, that's GIN. Then you need to be able to know the dosage, that's D, GIND. So you can just form a mnemonic for it. You need to know the dosage. After the dosage, you need to know the side effects. You need to know the contraindications as well as the nursing responsibility. So there are 7 key points, 7 key steps in talking about pharmacology. And even during exam, probably they ask you to write on a drug. Just write on this class of drug. Aspirin, acetaminophen, lisinopril. They just put it like it's a pharmacological question. They just put it under your med-surg exam and they just put it like that. You write on this drug. You must follow that pattern. Not that you start responsibility first. No, you must follow the pattern from the group, like that 7 basic steps. From the group to the indication, from the indication to the mechanism of action, from the mechanism of action to the dosage, from the dosage to side effects, to contraindications, like that. What's the responsibility? So that's it. So thank you so much for watching. Thank you for your time. Do well to share this. Don't be the one to enjoy this alone. Of course, it's educating. So do well to share it with your friends. Do well to share it with your colleagues at school. And not share alone. Comment, like, follow, and expect more updates from here. Thank you so much. Love you.